welcome to our Dermalux Academy webinar, and thank you for joining us this evening. My name's Louise Taylor from Dermalux, and we're excited to welcome our very special guest, Dr Simon Ravichandran from the award-winning Clinetics clinics up in Scotland. I'm going to let Simon introduce himself to you shortly, but we have been working with him very closely for many years now, and Simon is also our medical director. So Simon has a wealth of knowledge and experience, and we just wanted to find the right opportunity for him to share some of his valuable insights with us today. So we chose perfecting the patient journey. You know, it's an ambiguous subject, and appreciate that it is one that's very subjective to each individual business, but it's also a very topical subject at the moment. You know, as the industry opens back up and we're getting our patients back into face-to-face consultations. So we hope that you can take something from this and that it's a useful subject for you. So lots to discuss. If you have any questions, please feel free to put them into the chat, and we'll try to answer as many as we can as we go through. And if not, we'll address them at the end. So I'm now going to hand over to Simon and let him introduce himself to you. So apologies again. Thank you for your patience, but I promise it's going to be worth it. All right. Thanks, Simon.
Hi, Louise, and thank you very much. So yes, that was an exciting start, wasn't it, to the webinar? Always the way when we upgrade new technology. So completely understandable. These things happen in all walks of life. I think the good thing is though we're going to record this and you know make this available later on, aren't we, Louise? So you know you can have time to reflect on this at another time when maybe we're not in so much of a hurry. But we'll take it easy and get through the content that we wanted to get through today. So as Louise said, she asked me to introduce myself, which is always a very difficult thing to do because it sounds very much like you're blowing your own trumpet. So I'll try and keep it as humble as possible. My name is Simon Ravichandran. I trained as an ear, nose and throat surgeon with a specialist interest in facial plastic surgery here in Glasgow, where I now work. I developed a side interest in aesthetic medicine, and about 14 years ago set up an aesthetic medicine company with my wife, Emma Ravichandran. And that really grew. It became a passion for us. It became a life choice for us, to the point that we ended up getting too busy doing this job and we had to leave our NHS mainstream surgical and Emma's dental practices. So I'm a sole practitioner of aesthetic medicine, have been for about 4.5, 5 years now, on a background of 10 years previous practice before that. Now, I'm heavily involved in teaching. Teaching is one of my great passions. I think it's my duty, my responsibility, and a moral obligation of anyone in medicine to be able to pass on what we've learned to those of us who are up and coming and developing their careers. And to that extent, we've developed an aesthetic training academy, a digital training program, and we lecture around the world on all elements of aesthetic medicine, both practice, both theory, and in the business models that we can use to ethically improve and increase our businesses, but enhance our patient experiences. And that's really where today's webinar comes into play, because this isn't really a theoretical sort of how I do it process. Today, what we're doing is a sort of a step through the patient journey and what that patient journey means and how we can enhance that patient journey to the benefit of both our businesses and your patients.
So thank you, Simon. So we have had some questions and we've tried to sort of prep those in advance, but I suppose we should sort of kick off by saying, what do we mean by the patient journey? What does that, that mean to us as clinic owners, as practitioners?
Yeah, that's the best question that we're ever going to have. What is it that we're talking about? And I'm going to draw a couple of analogies and then translate them into the medical practice. So analogy number one is when I was about 20 years old, I developed an interest in hi-fi, and I wanted to go and buy a hi-fi or some hi-fi equipment. Now, a friend of mine went to Richer Sounds and bought an off-the-shelf product and brought it home, and he was very happy with it. And that was the end of it. And then 10 years later, he went and upgraded. He went somewhere else and bought something else. Nothing wrong with the Richer Sounds model. I love it. I've got a great deal of respect for that business model. There's actually a lot that we can learn from it.
I took a different route. I went to the local hi-fi specialist shop and I spoke to the people in the shop. I spoke to the manager, the owner. They showed me lots of equipment. They let me listen to lots of equipment. They talked to me and got to know about my position. They knew I was a student. They knew what I was studying. They knew I lived in a flat. They asked me about the process of how I listen to music. What situations would I be listening to music in? They even came around to my flat to have a look at the rooms that I'd be listening to music in. And then they sold me a system, a setup that was perfect for my needs. It was exactly what I wanted, exactly what I needed, and I was delighted with it. And it only cost me 500 quid. Now, in the years since then, I've upgraded various components of that device. I wanted to go from 2 speakers to 5 speakers. I wanted to get a flat screen. I wanted to get rid of my CD player, my DVD player, and upgrade to Blu-ray. Nowadays, I'm phoning these guys up and saying, okay, we've got a new house. I want you to completely multi-room and wire up my house. Now, my value as a customer to that individual shop could have been measured in 3 digits, £500. They could have sold me something and gone away, which was what happened to my friend. But my lifetime value, because of my experience and customer journey with that shop, is going to be, I'm sure by the time I'm 60, approaching 6 figures, maybe 5. Now, that to me is an example of a good customer journey. There's similar examples with the bike shop I go to. But the contrast to that is where you go and buy a commodity. It's where you go and buy a loaf of bread or a pint of milk. And you know that wherever you go, you're going to get the same loaf of bread or the same pint of milk. So it doesn't matter to you which shop you go to because the service is the same and the product is the same. There's no customer journey in that. So there's no customer loyalty, there's no upselling, there's no retention. It's just a very straightforward, simple transactional process. Now translate that to medical practice. When a patient comes to an aesthetic medical practice and says, I want to have 3 areas of toxin because I've seen it on your menu. It's a list, I've had it before, my friends have it, it's what I want. So we oblige, we give the 3 areas of toxin, the patient is happy, they leave, we very rarely see them again. We don't know what the outcome is, but the thing is they're going to go next time they need or next time they want that treatment to another unit, to another shop, and say, right, I want 3 areas of toxin. And they're going to go based on recommendation of any friend at the time, or they're going to go based on price or geographic locality. That is okay in terms of a single transactional model, but in terms of developing long-term patient relationship where that patient keeps returning to you time and time again, and not just for the 3 areas of toxin, but for exactly what they need throughout their lifetime aesthetic medical journey, is what we really should be focusing on achieving. And that's what I would call the patient journey. It's the process by which we listen to a patient, we take into consideration all of their individual concerns, their aspirations, their wants, their finances, their social circumstances, their medical history, and we create a bespoke treatment plan that's just for them. And when you do that, we retain the customer, we retain the patient returns to us for more treatments, for advice over a very long period of time. So that's the essence of the patient journey. And what we should be doing, and this is a fantastic opportunity for it, is to enhance our patient journey. We now need to differentiate ourselves better than we've ever differentiated ourselves before. With the opening of the units, the opening of the clinics after the lockdown because of the pandemic, we really have an opportunity to shine and show our patients what we really can do for them and really enhance that experience. And that's going to be better for them and that's going to be better for us. So that's in 2 or 3 nutshells what a patient journey is.
It's a good analogy, and I think sometimes it's just helpful to put it into a context so we can relate to it a bit. From our side, obviously we've got patients coming in and wanting that experience. So, but I suppose we rewind back to the beginning, and the analogy of it's that interview consultation process. Really, it's the fact finding. So we start, I suppose, the patient journey. The consultation is critical then, and the quality of that consultation and the time that we spend on it. So we have had quite a few questions around that. So I don't know if you've got any tips around the consultation or how you perform your consultation.
Yes, I can talk for days about the consultation process, Louise. Let's not do that.
No,
Let's
but I think
simplify it.
we're here to share some of
If
your
it-
valuable insights. So
let's share what we do. Okay. The consultation, you're absolutely right, is a really critical component of the patient journey. That's the part that builds the trust. And when we're at medical school, we learn that rapport is a fundamental factor of what we've got to do throughout a consultation. We have to develop rapport. That's a relationship between yourself and your patient. And that rapport is based on trust. So we have to build trust. How do we build trust? Certainly not by just bending over and saying, right, I shall do this treatment that you've asked me for without asking any further questions. Trust you've got to keep in your mind throughout the entire process. And then there's four main steps aside from the trust, which runs through everything. There's four steps that I think of in a consultation process. And two of them are very, very straightforward. And you can actually look into them in a lot of detail and analyze what you do and modify what you do to improve patient outcomes. The first one is opening the consultation. How do you start? How do you open the door? How does the patient come into the clinic? That's really, really important. So opening the consultation in the right way. And that's a body language, that's a mimicry issue, that's how to smile, it's how to engage, it's how to judge a patient in, a split second to figure out what's the best way to communicate and interact with this patient. And there's various ways you can look at communication, and there's various ways you can analyze the way that you communicate and you perceive others to really help you engage with that. So I would definitely recommend communication skills being something that you consider as focusing as part of anyone's personal development plan. And then there's the leaving, the exit part. And I think we're going to talk about how we, how we exit a patient or outboard a patient at the end of a consultation later on. So we'll come to that later. But in between, there's two critical components. And these are the ones that build the trust. And these are the ones that let the patients know that you're listening to them and you care about them. And these are the parts that allow you to really make exactly the right decision for your patient. And that's gathering the information. So that's the interview process. And then it's the explanation process. So our job as medical practitioner is to listen. We have to listen. We have to sit back and listen to our patients. There was a study done quite a long time ago that noticed that doctors usually spend about 13, 14 seconds listening to a patient before we interrupt. And I would challenge all of you to try and make that 1 minute. It's really, really difficult to sit there and listen to a patient for a minute without interrupting. But if you let them, they can give you a lot of information about themselves, socially, personally, psychologically, what they want in 1 minute, so long as you don't interrupt them and start driving them down the direction you want to. There's a lot to be said for structure, which is where you do take the conversation that you want it to, in the direction you want it to go. But that listening, and what you're doing when you're listening, you're playing the investigator, you're the detective. The detective game is to listen to all the little clues, the visual clues, the verbal clues, what they're actually saying, the way they're sitting, the way they're expressing themselves whilst they're saying it, that will give you a really good insight into their personality. That's really important. Now, once you've done the listening, we do this process called, the surgical sieve. There's a diagnostic method of finding out what the actual process involved with the patient is that they want to improve. But we start with an opener, a really broad opening question that allows them to talk about whatever they want. And it's, what can I do for you today? Something as simple as that. Not, which part of your face is bothering you? Not, oh, is it your pigmentation? Or, right, is it your lines or wrinkles? These are closed questions. These are going to direct things in the way you want to go. So we start with an open question. What can we do for you today? And then I sit and I let them talk. And I let them talk for a minute. Maybe I let them talk for 3 minutes. And I will only interrupt when I want a little bit more clarification of what they're saying, or when they're going off at a tangent that seems to be irrelevant. And then we bring them back into that. And throughout the course of that process, with practice, you'll be able to get a lot more information out of your patient, and you'll find that you'll be much better placed to actually help them achieve their aesthetic aspirations and goals. The clear example of that is when the patient says, I'm bothered by a bit of pigmentation and a bit of redness. And then we go, great, we stop there. It's brilliant, because you know what? I've got a treatment for pigmentation and redness. It's called Dermalux phototherapy. So this is what we're going to do for you.
If you ask them more about the pigmentation and the redness and get into more detail about it, find out what sort of treatments they're prepared to have, find out how much downtime they're prepared to go, find out what their budget is, then you can tailor the treatment plan accordingly, specifically for them. If you let them complete the story and you have all the clarity and information about the pigmentation and redness that's bothering them, then you can say, is there anything else that's bothering you? And this is the bit where they go, actually, yeah, there is. I'm actually bothered about, my jawline. It's really starting to get me down. I'm bothered by these lines and wrinkles, the coarseness of my skin. I spent 7 years living in Spain, and I've really noticed that I'm getting really old looking. Lots of other things start coming into the mix. So that listening, and I don't want to call it a game because it's not a game, that listening project where you sit and you listen and you engage with the patient serves two very important functions. One, it allows you to formulate a list, a structured list of everything that's bothering that patient, and you prioritize it in order of what's most important to what's least important. The second important thing is all about that customer experience or patient journey. You're letting the patient know you care. You're letting them know that you are interested in the problems that they have and you're working on a solution for them. And that is so unbelievably important because a patient will always go to the doctor, nurse, dentist, or practice or therapist that cares and listens. We have to be that person in order to retain our clients and make sure they leave satisfied with the outcome. Now, once they know that you care, once they know that you're listening, then they're engaged. Then they are receptive to what you have to say. And that's the point where we can go from information gathering or history taking over to explanation and planning. And this is the part of the process where we say, okay, now it's my turn to talk. It's great. I've listened to you talk for 15 minutes, but now I'm going to say something. Let me just clarify what we've just said. Based on your discussion, based on our conversation there, I think these are the 4 things that are bothering you. And I think this is the priority. I think this is probably the second most important thing. The third thing is kind of okay if we leave it or we don't do something about it. And the fourth thing is something we maybe want to come back to in 5, 6, or 10 years at a later time because it's not bothering you that much right now. And they'll go, yeah, that's absolutely right. So that reinforces the idea that you've listened and you've understood. So then we go, right, I've got some treatments for number 1. I've got some solutions to your problem. And these are these solutions to your problem. So we go through maybe 3 different solutions for the problem that I think may be appropriate. I may even throw one that I think isn't appropriate, but is sometimes a solution for that problem. So they know that I'm explaining everything to them. And I might couch it in terms like, this is what I think the best thing to do is, and go through that. And I'll say, but there's also 2 other alternatives. The advantages and disadvantages of it, of option 1 are this, and the advantages and disadvantages of option 3 are this. Would I be right in thinking that option 2 is the one that you're leaning towards? Okay, then we do the same throughout the whole list. Now, at the end of that list, what I've got is a treatment plan. I have got a treatment plan that will involve topical home care, interventional treatments in the clinic, and non-invasive treatments in the clinic. And we don't do all those at once. And we know that some of these are going to improve skin health. Some of them are going to maintain skin health. Some are going to give short-lived results and we don't need to do again. Others are going to give temporary results that we need to keep improving. And others are going to give results that will continue to get better the more we do them. And this is one that Dermalux falls into the category of. So we present the treatment plan to the patient and say, I think we should do this. I think we should do this treatment on day 1. I think we should do this treatment on day 5. I think we should do this treatment a week later. And then every month, come and see me or one of my therapists, and we're going to do this treatment. And they'll agree with you, and they'll trust you, and they'll book in for that treatment. And there's nothing manipulative or unethical about that. All you have done is taken the time to listen to your patient and give them the treatment plan that is actually going to achieve their aesthetic aspirations. And it's going to take a long time. It's going to take years, but it doesn't matter. That's part of the process of the consultation. It's the explanation part. It's where we tell them, we can do this, but it's going to go back to normal, or we can improve, but you're going to need to maintain, because that's what patients want. They don't want temporary improvements in skin health. They want long-term improvements and long-term maintenance programs. So by following a model similar to this, and this is my model, and I guarantee literally no one else does it exactly the same. Some people will do it quite similarly, but everyone has to adapt their own version of a model like this to make sure that they're listening to a patient, gathering information, presenting it back to a patient, and then creating a treatment plan to get that trust. And that's my process of consultation, Louise. Does that kind of fit in with what you were thinking?
No, I think, it's like I said, it's putting it into that context, and, it's looking at the critical part. And I just keep thinking about what you said at the beginning about, we can put that into any situation. But I suppose there's a few questions in my mind that's come out, and I know we've had some questions before, but I suppose this is a very solution driven sort of process, rather than thinking about, oh, I've just got a list of treatments and, sort of trying to slot them all together, or just selling a package of a treatment. It's actually, you're presenting a solution which will, in the best scenario, actually combine multiple treatments, from home care, like you said, interventional treatments, non-invasive treatments. So it's a long-term program. So you're not just thinking of the here and now, it's the longer term as well. So.
It's always a long-term program. Skin health is a long-term maintenance program. We don't have a pill or a treatment or a cream that is going to stop you aging, for example, and leave it at that. We will continue to age. We have chronic skin conditions that will continue to cause problems as time goes on. So, in my opinion, there's no such thing as a single treatment module. There's not. I don't sell my patients any courses of Dermalux in blocks of 10. It's part of a lifelong program of skin maintenance and skin health, and that applies to all of the treatments that we do, with a few exceptions. The surgical exceptions. A facelift is a facelift, and I wouldn't expect to see a patient for another 10 years. But the skin health, the skin maintenance, it needs to be thought of not as a commodity, not as a treatment, not even as a course of treatment. If we're doing that, we're just selling products. We're selling commodities. A commodity is a course of 10, whatever. What we've got to do is think about what's in the best interest of our patients, which is going to meet their lifelong aspirations of skin health. And that's a long-term treatment plan. So we've got to change the mindsets here, haven't we? We've got to change our mindsets from selling something. I've got something, I need to sell it. Yeah, job done, brilliant. Doesn't work like that. You've got to change our mindset into providing long-term healthcare for our patients. Will be a series of treatments over a long time. And the treatments will change as the patients get older and the skin health changes. And we've got to change the mindset of our patients as well, because we may still find that we have patients who just have seen it advertised. I've seen this treatment. Just, such and such a celebrity's had it. Give me this treatment. Fine. But we have to tell them that this is just a treatment on its own. It's not a means to an end. What we want to do is find out what the problem that the patient has is, and then offer them an appropriate solution. So we don't sell treatments, we sell solutions. I think that should be clear.
Yeah, no, absolutely. I remember somebody told me once about an analogy of, like, let's say you want to, build, or fix a chair. You don't just use one thing. It's not just a hammer. You need hammer and nails. And it's about looking in your toolbox and looking to provide the complete solution in that. And actually, just, I think it's been interesting over some of our recent webinars, and for anybody who hasn't seen them, they're all available on YouTube. But, changing our mindset and actually thinking that, LED, because it's become such a popular treatment now, and, the technology is advanced, that we can deliver some fantastic results. But this actually underpins, it's like a foundation treatment for skin health. So it's not, no longer is it, just an add-on or just something that we have to think about as an afterthought to upgrade, but actually, it underpins that and should be fundamental right from the beginning of a treatment program for everybody, because we know it's so safe and effective, but alongside like we would with their home care program.
Yep, absolutely. I think the days where people would, oh great, I've had some LED treatments and I feel wonderful. Well, that's good, yeah, but it's not the way it should be anymore. It's not a standalone treatment. It's an ongoing part of an ongoing treatment plan. And yes, the aging face is kind of like the chair that's broken, in that you need a whole toolbox to address it. We're going to be addressing the skin long term. We're going to be addressing the muscles long term, and the fat long term, and the skeletal structure long term. As time progresses, we're going to be looking more and more at hormonal medicine. So we're going to be addressing that long term. We're going to be doing more and more within the scope of aesthetic medicine, in anti-aging, rejuvenating medicine, as well as in the treatment of common skin conditions such as acne, psoriasis, and rosacea and other red skin conditions. And these are chronic issues, all of them, from rosacea through to aging. It's a chronic condition that we need to create long-term treatment plans with a variety of different products in it.
Yes, and I think looking at the benefits of using LED for these inflammatory conditions, like you said, even aging is an inflammatory chronic condition. So, using things that can help to modulate that are really important. But I think one question which I'd quite like you to answer, if possible, is, so you've got your patient there in the consultation. Obviously, you've got Dermalux as part of your sort of solution or options for a solution. But how would you talk to them about it? How do you sort of educate them about, sort of also mindful that there are quite a lot of LED devices now in the market. We've come out of a lockdown. People have been using, devices for themselves. So how do we present that to, the patient sat in front of us?
Yeah, so it's a kind of how we explain how it works. And yes. I try to do this with every treatment that we do. It's because the science is exciting and it's interesting, and I'm a complete nerd, so I can talk about cytochrome C oxidase and displacement of cupric ions all day, but that's not what your patient wants to hear. Your patient wants to know a few things. How much does it cost? Is it going to hurt? Am I going to look silly? What's in it for me, and what's the downtime? And that's the 5 things that you can list any treatment for, that any patient will really be secretly wanting to know about any treatment. So it's how's it going to work and what's in it for me? It's part of the education part of the explanation, part of the consultation process. So there's still a degree of skepticism amongst our patients that say, wait, what's it going to do? It's not going to do anything. So how does it work? So I don't talk, unless my patients have PhDs in physics or biology or something like that, then I don't go into too much detail, other than to say that we're aware that light has interactions with skin, okay? Not lasers, light. Normal daylight has an interaction with skin. We can see that because normal exposure to sunlight increases pigmentation in your skin to get a tan. So light does something to skin. Now, what we don't see is the other things. So we can explain to patients that when they go on holiday and when they lie on the beach, they sometimes feel a little bit euphoric or a little bit sleepy and really relaxed. And that's actually a light interaction with the retina, which releases some endorphins. So that's another reaction that it has. And we relate it to experiences that the patient has. It's all about, it's experiential explanation, finding that link, that relationship. And then we can say, well, when you're in the sunlight and, you have acne and the acne clears up in the sunlight. Okay. Oh, yeah, okay, I've noticed that. Well, light can help get rid of acne. And then, how you've been lying in the sunlight and God forbid you've been on a sunbed, but you've come out of it and you've felt that your skin just feels more hydrated and firmer. Okay, fine. These are things that patients can relate to. And then we say, well, you know what? We've taken the 3 bits of light that do those 3 really good things.
We've got a bit of light, which is 415 nanometer wavelength of light, which is actually absorbed by a chemical in the bacteria that cause acne, and it kills them. Okay, no more explanation than that required. And then we've got the red light that penetrates a little bit deeper. And we know that that will stimulate a series of processes within the skin that's going to help increase the breakdown of some products, your broken collagens, your broken elastin, and upregulate some other products. And we know that it's going to help reduce inflammation because of the interactions it has with skin. So it's going to settle redness. And then we say, well, we've got the infrared light as well, and that penetrates even deeper into the skin. And we know that that is going to cause a production of collagen. It's going to upregulate your dermis's production of collagen. We keep it as simple as that. And that can be explained to a patient. And that's something that they would understand. And they go, right, okay, that's fine. Now it makes sense. This is a treatment that I want. When can I have one? When can I start? So that's the simple explanation that really, so long as you can relate it to a patient experience and then swing that back to the service or product that you have, which is the Dermalux, that's going to work. And then the next thing you asked, Louise, was it's been locked down. People haven't been in the clinics. They've been buying the at-home use devices on Amazon, and they're saying, I don't need to come anymore because I've got the home use device. Then we have to go into the explanations of, well, the home use device is fine. They're okay. They're not, but they are nowhere near as good as a particular device, a Dermalux device. And the reasons for that. Now, the reasons for that are, it fundamentally comes down to power output and the peak wavelength specificity. Now, that's a difficult concept to explain to a patient. So sometimes saying the device that we have is a medically approved device that has a much higher power output at the desired wavelength, so we get a much better result. That should be enough. But if you personally want to understand a little bit more about it, take, for example, the blue lights on the off-the-counter blue lights that are used in a lot of home use devices. They tend to be a higher wavelength of light. So they're around the 450 nanometer mark. They say 450 nanometer, but that's the peak power. That's the bit where the power is highest. But it doesn't actually tell you what the spread of power is. So the spread of power could be over a much wider wavelength of light. People like the 450 nanometers because they look brighter, so they think they're more powerful. Yeah. Whereas the 415, which is exactly what we need to kill the bacteria, isn't quite as bright. It's got this kind of pale lilac-y type color. So they see that and, oh, it's not doing anything. It's not powerful enough. It is really powerful. It's just like infrared. You can hardly see it. So you need an LED that specifically puts out the highest power at that wavelength. Because LEDs aren't wavelength specific. When we say a specific wavelength of light for LEDs, we're talking about the maximum power is at that wavelength and not another one. And it's not a big spread. Now, the Dermalux devices are using LEDs that have been specifically designed for this medical indication. So they are specifically designed to have very high peak outputs at the target wavelengths with very little variation on either side. So we're very powerful and very targeted towards specific indications. So that's the way we need to try and couch that in language that your patient will grasp and will understand if they need to go to that level of detail. But fundamentally for you as a practitioner, if you don't know, that is the difference between a Dermalux in-clinic phototherapy device and any of the home use devices.
Yeah, so I think it is. It's, we've been trying to sort of help people with this, going back into the situation now. So I think, yeah, we're at the medical grade, the medical certification, the professional, the high power. And, we could say that about, home use hair removal devices versus in-clinic hair removal devices or lasers, they're, it's exactly the same kind of analogy. It's just something that people can buy over the counter is never going to have the same level of power because of safety.
It's not. Yeah. It's not, because you need to get them in order for it to actually have a medical physical effect on tissue, which is going to result in a change in skin health or appearance. That definition makes it a medicine or a medical device, and that makes it required to go through the medical device CE in the UK or FDA in America or any of the other things. If it's actually interacting with skin tissues,
in any meaningful way, it's a medical device. So if it's sold over the counter and it's not a medical device, it's not going to have the same result.
But yeah, there's a lot of analogies on that. So yeah, well, thank you. I think, like you said, patient education during the consultation process is important, I suppose, if we're trying to not sell the treatment, but actually show them the benefit of that over a longer period of time as well, and how that underpins, what we're doing. What about sort of timing on consultations then? So, obviously, you've got a lot of treatments in the clinic. There's so many things from products and that we can explain. But do you think there's a maximum time we should allow?
Yeah, I think there probably is a sweet spot. Let me ask you, Louise, if you came to see me in practice, how much time would you like to spend with me in order to explain your issues and have me explain the solutions to you? How long do you think that would take?
I think it depends on how targeted it is. I think that people would expect, I'm thinking I'm going to come into you. I've got these issues, but I'm looking for a solution, and I want that time invested in me to understand that. And I think like you said, it's about rebuilding that trust. But equally, I don't want to be sat there for hours and hours on end, because it's we're coming to you because you've got the knowledge and experience, so you're going to be quite concise in how you and experienced in how you put that together.
But you don't want it to be too short, because you'll know I'm not listening to you. You don't want it to be too long, because honestly, you're going to get bored. You'll be sitting there going, I only came in for my Botox. So there's a sweet spot in the middle. And for me, it's half an hour or less. And I think half an hour, generally speaking, is more than enough time for me to actually have a meaningful conversation with the patient, explain everything I need to explain, make sure that they understand it, and arrive at a treatment plan and a treatment journey for them, and then make sure we've got time to get going. So I book half an hour slots for every single consultation. That usually involves 20 minutes of consulting, and then 10 minutes afterwards of booking an appointment, documenting all my notes, and preparing for the next patient. And I think for me, half an hour works very well. Now, I'm going to accept that other people will do things different ways. Other people have different demographics of patients who might want a longer, more involved consultation process. But my opinion is, if I spend an hour with a patient, I'm probably going into too much detail about everything. Probably a lot more than they actually need. We've got to put the information to the patient in a way that they're going to clearly understand, and that they're going to be able to digest and use to make decisions with about their treatment. And if we're going on for about an hour, at the end of it, their brains are going to be mush. You all know what it's like. It's the end of lockdown. We've sat through webinar after webinar after webinar, and after the first 45 minutes, you're lucky if you're still hanging in there. You start to shut down, and it's, can't cope anymore. I'm only here because I told Louise I'd be here. No, I know that's not true. You're all here because you really want to hear this, because it's gold. But an hour for a patient, for me, is too long. Now, I sometimes have patients that keep me talking for an hour. I sometimes have patients with really complex issues, complex problems, who need stuff explaining in different ways over and over again. Now, with a half-hour consultation, I can have the chat, I can do what I'm supposed to do, create the treatment plan, let them go, and that's the end of it. With a 1 hour consultation, I'm not going to do that. If I start the consultation by saying we're going to start by doing carbon dioxide laser resurfacing of your face, and then from that, we're going to build the entire treatment journey. By the end of that, when they say, yes, I want to do that, I'm going to say, no, I don't want you to do that, because you've forgotten what I said at the beginning. You've forgotten bits in the middle. I talked about high-risk procedures. I talked about big downtime. What I'm going to do is write you a long email with bullet points that breaks everything down with information for you to digest. And I want you to go away, and we'll come back, and I'm going to have a half an hour chat with you in a week. And we'll go over those bullet points, and we'll see what you want to do, because no one is going to be able to absorb all that information and make a rational decision if I've just been bombarding them for an hour. So for me, half an hour is the right one. If you want to spend more time with your customers and do the 1 hour thing, because certainly a lot of customers will feel like you're giving them more value by doing that, I would certainly consider following that up, not with an immediate booking, but following it up with a phone call or sending them some information or just getting someone to give them a ring or another virtual chat, just to make sure that they're happy and they understand and they don't want to go over anything again in a lot of detail.
So I suppose it's how much choice you give them. So you've gone through that interview process. They've told you what the issues are. It depends how many different kinds of solutions I suppose you're going to present to them. But it's refining that, isn't it? And then sort of keeping it, like you said, simple for them. But another question that came up when sort of when we were sort of promoting this is about charging. So I suppose you're going into the longer time, then it's you charge, do you don't charge? I know that's something that people struggle with.
Yeah, and you know what? There's no right answer. A lot of colleagues of mine would say you have to charge. You're offering an expert consultancy service. Your time is money. You are worth it. You have to charge. If you don't charge, you're devaluing yourself. You're devaluing your company. You're devaluing your service. You're devaluing your brand. That's not 100% true. There is truth in that, but it's not 100% true. And it's not 100% true because across the board, throughout aesthetic medicine in the United Kingdom, not many people do charge. It's only a very, very small number of people that charge. So by not doing it, you're not devaluing your brand. But by charging, you are placing a premium on your brand. You're already saying right from the beginning, we are premium. We are luxury. You want to come and talk to me? We are worth it, and we're worth whatever you want to charge. So generally speaking, I charge for my consultations. I don't charge much. It's only £50. It's a token fee for a consultation. I know in reality, I should be charging £250 for a consultation, which is what I would be doing if I was working in the non-aesthetic private healthcare setting. But I think £50 is enough because since I started charging for consultations, my fail to attend rate dropped to essentially zero. Now, the other worry is people are going to come to consultations and feel that because they've already paid a fee in advance for the consultation, they're kind of obliged to follow through. And we do that because most people will say, if you follow through and have treatment, then I'll deduct the cost of the consultation from the treatment plan. That's something I was rarely doing. So it takes that incentive out of it. But if you are doing it, we always have to make it clear at the end of the consultation, or I chose to make it clear at the end of the consultation, that if they decide that they don't want to go ahead, that's fine. I'll refund your consultation and we'll refund them on the way out. They'll get that paid back because I don't mind. The charge for the consultation is to make sure that they come and they listen to what I have to say. And we've got a conversion rate of patients to treatments, consultations to treatments, probably in excess of 99% at the moment. So it's not a huge loss if I have to refund 1 in 100.
And do you ever get clients that you feel are not, I mean, we're talking about the patient journey now, and we're looking at making that, that lifetime, getting that lifetime value and just looking at the long term. But what about if somebody came along and they're not quite, they're not right for this patient journey, or, is there a criteria? Does it depend on indication, age, are they looking for discounts, that kind of thing?
Yeah. Well, if they're looking for discounts, we can talk about that. I wouldn't, we don't do discounts. I think
a different kind of
discounting.
Yeah.
Yeah. Discounting is going to invite the wrong patients to your clinic. It's not going to invite patient journey patients. It's going to invite commodity-based patients who want a treatment. They don't want advice. They don't want an opinion. They want a treatment. And then once they've had that treatment, anyone who wants treatment is going to treat it like a loaf of bread. They're going to go to the next shop down the road and get it to the next cheapest place next time. So I strongly advise against discounting. If anything, I would advise putting everyone's prices up a little bit because it helps create the concept, the idea and awareness that you are actually a premium service with a premium product and you're a premium brand. So discounting is not a great thing. In fact, If you want to be cheap, you can be cheap, but don't discount, don't say we're 50% off. You can just pitch your prices there. Keep them at that point, and then you can work within that demographic of patients who want to do that. Or if we're going to be premium, you can pitch your prices high and make sure that you've got everything around that premium end to make sure you can justify the premium service. And those two are both absolutely fine business models. There's nothing wrong with doing it. But to say you're premium but offering discount, really, it devalues your brand and gets you the wrong patients, and it's not a successful way of growing a business and growing a patient base. Now, for the patients that we get who want a treatment or a treatment journey whom I feel are inappropriate, so these are the sort of patients that are usually inappropriate in terms of not having the correct expectations from treatment. They're the people who would like to have a course of Dermalux, but would expect to look 5 years younger or 10 years younger at the end of it. And yes, of course, we can't treat these patients because we go through the treatment journey, we go through the treatment plan, and we don't meet their aesthetic expectations and aspirations. So at the end of the day, you get an unhappy patient. And an unhappy patient is not a good advert for the business, because an unhappy patient is very likely to go and tell a lot more people how unhappy they are with your product and with your service. They may become a litigious patient, which causes you more stress and more grief down the line. So we need to figure out ways, or we need to read about ways, because this has been written about, discussed, documented, and publicized in hundreds and hundreds of papers, of identifying patients that you shouldn't be treating. And it's the red flag system. So obviously unrealistic expectations. And there's actually a really nice questionnaire about expectations from treatment. I think it's just got 7 questions on it. And if they score highly on that, you can say, you can just tell right away that they are not for any sort of treatment whatsoever. But there's other things that they can do, like making multiple appointments with your clinic and not turning up is actually an indicator of a patient who's going to eventually cause you problems. Patients who don't appear to be telling you the whole truth. So patients who say they've never had any previous treatments, but it's clear that everything's looking a little bit distorted. Patients who will tell the receptionist one story and then tell you a completely different story. And I don't know why they do that, because the receptionist talks to me all the time and tells me everything. But changing stories is another really big red flag. And the final red flag, the most obvious one, and it should be the most obvious one, but we do all get caught out about it, it's the patient who doesn't appear to be listening to you when you're explaining things. And what they'll do is they'll keep asking a question that you've already answered, so you rephrase your answer in a different way. And then they'll ask it again, so you rephrase it in a slightly different way. And they keep asking it until you explain it to them in a way that fits their mindset. And then they go, oh, great, I'll have that treatment. And then, of course, they have the treatment and they're not happy because you knew it was the wrong treatment for them in the first place, but they were just finding the answer that they wanted to hear in your dialogue. And literally every single patient that I've had a problem with, and there haven't been many, but every single one that I've had any sort of problem with after treatment due to dissatisfaction, I can trace that back to the consultation where I did an ineffective consultation. I didn't explain things properly, or it was apparent retrospectively that they weren't listening to me and they were determined to have a treatment, not a solution to their problem. So that's really important.
Yeah. So we could almost say that it's like a two-way interview process, because yes, you're, obviously you're finding out about them, but equally, and that, is it the right thing? Is it right thing for both parties, in terms of recruiting
Louise,
them?
Do you know what I say to my patients, my new patients at the end of a virtual consultation now, after we've had the chat and I explain everything and they go, are you happy with that? I then look them in the eye through the camera and I say, okay, I'm happy to take you on as a patient because you seem to have realistic expectations about what to expect. But the bit is, I'm happy to take you on as a patient. You do not have an obligation to treat everyone who comes to your door and has a consultation. You have to be comfortable taking them on as a patient
just as much as they have to be comfortable taking you on as their practitioner. So I tell them, I'm happy for you to be my patient. You can come in. Welcome to the club. And I think that's just a nice way of psychologically explaining to them that, you know what, this is actually a two-way thing. You don't get to make demands of me, and I in turn will respect you and not give you treatments that you don't need. It's a two-way process.
But I suppose any journey is a commitment. It's, they've got to commit on their side in terms of turning up, doing what you want them to do. If they're going to get the end result, I suppose it's like taking a course of antibiotics. If you don't take the course, then are you going to get the end results? You've got to be committed to that as you go sort of through. What one question that has come up is about new patient recruitment, about how do we get sort of patients through the door, new patients. Obviously we're talking about new consultations.
Okay, that's interesting. I was scrolling through Facebook earlier on today, and up popped a podcast that I did for someone else's channel about a year ago, exactly about new patient recruitment. So that's fresh in my mind. I could probably recite that word for word, but that was really a business structure one. We were talking about developing a market proposition or a value proposition. And the key to that is, you know what you've got, but your patient doesn't understand what you've got. You've got to ask your patients what they want. You take what they want, what you've got, and then you find somewhere in the middle, and that's your value proposition. So you do not sell them a device or a treatment. You don't buy a brand new £100,000 laser and then start telling everyone, you've got this wonderful new laser. They don't care. They don't know what that laser does. What you do is you say, I have got a device or a technology that is going to improve your quality of life by removing pigmentation, blemishes, fine lines. Okay, that's the initial level. That's step one. Step two, we're going to improve your self-confidence, your self-esteem. We're going to make you feel more comfortable socially. We're going to improve your psychological perception of your own self-awareness. So that's step two. And step three is self-actualization. We are going to improve your quality of life, full stop. So there's a stepwise ladder of things that you have to put into place for every product and every service. And I don't personally individually market individual treatment technologies so much anymore. We just market the solutions that we have. So we tell people that our clinic is dedicated and committed to improving people's quality of life by changing things about their appearance that's upsetting them. And that's a message that resonates with people reading the marketing and the literature. That's what makes them pick up the phone. So how do you recruit new clients? How do we recruit new clients? Well, the usual channels, social media. So we've got a Twitter feed, we've got an Instagram feed, we've got a YouTube channel. We have a podcast. We have Facebook. I think that's it. There's probably one or two other things that the marketing people do as well. But the messaging is consistent. And there's a little bit about products, a little bit about services, a little bit about treatments. There's a lot about how we're going to improve people's quality of lives by making you feel happier, making you look a bit fresher. That's it. Then they come in, then they have the consultation, and they don't say to me, I want Dermalux. They don't. They say, what can you do to freshen up my skin? Because it's looking tired. I'm fed up with it. It's actually getting me down. And that's the beginning of a dialogue we can really get involved with. And Dermalux is a big part of that, as is a lot of other treatments. But there's no standalone thing that's going to fix it. What's required is a long-term commitment and an awareness that it's going to take a lot of effort over a lot of treatments. Hopefully not so much effort, actually. I guess our job is to minimize the amount of effort it takes. We want to make it easier as possible for our patients, but it's definitely going to take a bit of time and a bit of commitment.
So it's setting people's expectations at the beginning, so they don't get disappointed in that respect. Somebody just asked a question actually, which it could be it fits in with this about what products are best advised for aftercare or home care, is sort of within a skin journey. And I suppose that's quite ambiguous because there's lots of different different brands, but.
Yeah, so I don't want to be brand specific. You can, if you want to see what brands we use, you can look on my website and see what brands we use, and they're all recommended.
Yeah, so core ingredients maybe.
Core ingredients, yeah, exactly. The principles of skin health. So let's just say we're talking about rejuvenation. We're having a Dermalux protocol because we want to rejuvenate. So don't forget, that's your course of 10, followed by regular Dermaluxes every week, every 2 weeks, every month thereafter, just to improve and continue to maintain. But we want to do something at home to help maintain, to help improve and work synergistically. So you need alpha hydroxy acid cleansers. So glycolic acid, salicylic acid, lactic acid. And for those of you who know and are just going to say, sitting there at home going, salicylic acid is not an alpha hydroxy acid. I know it's not, but I've just bunched it in there anyway. So the alpha hydroxy acids in cleanser form, in scrub form, in pad form, in whatever form you want. The alpha hydroxy acids are the best first line at improving skin health. Once you've used your alpha hydroxy acids, then it's the slightly more active ingredients. And the main one has got to be the retinols. So a retinol after your alpha hydroxy acid program, finally an SPF. So a standard, the standard Simon Ravichandran skincare program is alpha hydroxy acid followed by retinol, followed by sun protection factor. And then we adjust it. We can modify it depending on individual patients' needs, expectations, their ability to tolerate retinols. Do they have redness, need anti-inflammatories put in there as well? Do they have a dry skin condition and require more moisturizer? There's other things that we can add into it, but as a fundamental process, AHA, retinol, SPF. And I would start a patient on that as soon as possible. They stay on it throughout the Dermalux process. They stay on it forever afterwards, even whilst they're having their regular maintenance Dermaluxes as time goes on.
And somebody's asked if there's a level of vitamin A that is contraindicated to the LED or the Dermalux treatments, but not. We just wouldn't use it at the same time. We're using it at home, and then we're having the LED treatments in the clinic. Is that what you would?
So yeah. No, I wouldn't. I don't think there's any need to put a vitamin A. So vitamin A is retinol, so it's your retinoids in your tretinoin.
At home.
I don't. They're used at home, and they're best used. Almost all formulations are best used at nighttime because they get denatured by ultraviolet light. So you put them on in the morning, you go outside, and then anything that's on your skin stops working. So they're best used at night. And in fact, you'll know we get retinoid reactions. You can get dryness, irritation, flaking of skin. What's the best thing for that? Well, for me, it's actually a Dermalux treatment. So my patients on aggressive retinol and tretinoin programs, part of their treatment program is coming in for a Dermalux every 2 or 3 days because the red and the near infrared is exactly what you need to help settle that down.
Perfect. Yeah, no, and that's exactly what we would recommend as well. So no, there's nothing that's contraindicated from that point of view. So, wow, I think we've covered a lot of information there. I think we've covered sort of most of the questions. We're just having a look at anything else that we had in, but I think we've pretty much covered it all. So, if there are any more questions and we haven't answered them, you can send us an email to the info@dermaluxled.com. I just wanted to thank you, Simon.
Thank you, Louise, for inviting me. It's been an absolute pleasure. I really enjoyed it, and it's always really, really good to see you again. I haven't seen you in so long. We need to do another one of these.
Yeah, we were thinking about, so if anybody's got any ideas of things that they would like, any other topics or subjects that you'd like us to talk about, Q&A sessions are always very good. Obviously, we try and limit the time because, we appreciate everybody's busy, and obviously we're going back into sort of busy period and working hopefully now, but, we would like to continue to do these educational webinars. So any ideas, please send them on an email to us, and we'll look at doing a Q&A session too. So thank you again to everyone. Thanks, Simon. And take care, and good luck for next week for everyone who's starting back up. But and we hope to see you very soon.